Namaste to everybody. Here again we meet to the second session of Tadvidya Sambhasha. I am Dr. Ranjini Deshpande in front of you. First of all, I'm sorry for the rescheduled session which was supposed to be conducted yesterday. Sorry for that. Before we start the session, I would like to start with a small prayer. Gnananandamayam devam nirmalasphatiकाकृतिम् आधारं सर्वविद्यानां हयग्रीवम् उपास्महे ॐ नमामि धन्वन्तरिम् आदिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारुभयमृत्युनाशं दातारमीशं विविधौषधीनां ॐ शान्ति शान्ति शान्तिः. Good afternoon again. So in today's session, we will be dealing with the next aspect of Bhagna or fracture. So in the last session, we had seen an introduction to basic introduction to the anatomy of the bone, anatomy and physiology of the bone. So we have seen the microscopic, macroscopic structure of the bone. We have seen the different bone cells, what are the functions of bone cells. So today, as a continuation to the previous class, we will be starting with the introduction to orthopedic trauma. I hope the audio and the video is clear. If anybody could please post a reply, it would be clear for me to continue further. Okay, I believe that it is clear, so I will be further moving on with the session. So today we will basically see an introduction to orthopedic trauma, that is what is the classification of different types of fractures, what is the how it is classified based on what factors, and then we will see individually the examples of basic fractures, and after that we will be seeing certain a few examples of fractures with respect to eponyms, wherein the fractures are named after the doctors or the scientists who have coined them, who have named them, not the scientists, I'm sorry, the doctors or the orthopedicians who have named them, who have introduced them. So first, basically, now we will be seeing, suppose if there is any musculoskeletal injury. So now we have a musculoskeletal injury. So in this injury, in this type of injury, what are the tissues or what are the various components that get injured? So basically, what are the different components that gets injured? So first we have the bone tissue gets injured. Obviously, next are the muscles that are attached to the bone. So even the muscles get injured. Next, we have the tendons and ligaments that get injured. Next, what is very important is the neurovascular bundle. So taking this into consideration, suppose in general, if there is a musculoskeletal injury in our body, then what are the different things that comes into the picture which also gets injured is, we have the bone tissue, we have the muscles that get injured, next we have the tendons and ligaments, both of these which are attached to the bony surface, even they get injured. And also along with that, obviously when the muscles gets injured, we also have the neurovascular bundles that are running through them that will also get injured. So this is the prime basic, what are the different things that gets injured in any musculoskeletal injury. Next, now we move on to the classification of fractures. Now we move on to the classification of fractures. I'll just also remove the main heading. Okay. Now we move on to classification of fractures. I hope everybody is familiar with this symbol. This we use to denote any fractures. So moving to the classification of fractures. Now any fracture can be classified under 4 headings. First is the etiology. Because of what is the fracture occurring is the first classification. Second classification is based on displacement. We will deal further what exactly all of these are. Second classification is based on the displacement. Now we have the third classification. Third classification, I'll be writing it here. It is based on its relationship of the fracture with external environment. So the third type of classification is relationship of the fracture with the external environment. That is the third variety. And next, the fourth variety is the pattern of fracture. So we again deal with the classification. So now we are looking to the classification of fractures. So any kind of fracture is broadly classified under 4 headings. So under these 4 headings you can classify any kinds of fracture. So the first is based on the etiology. What are the different etiologies? We will deal further. The second point is, the second classification is based on the displacement of the fracture fragments. Simply it is, in a brief, it's called as based on classification based on displacement. Next is fracture classification based on the relationship of the fracture with external environment. I repeat, relationship of fracture with external environment is the third kind of classification. The fourth classification is based on the pattern of fracture. So now we will be dealing in detail of what exactly each of these consists under its heading. Okay, now we will go with the first classification, that is based on etiology. Now under etiology we again have 2 subheadings or 2 subclassifications. Now what are they? The first one is trauma and the second one is a pathology. So first, it is almost self-explanatory. So in the first heading, now we will deal with the trauma. Etiology is trauma, and that leads to traumatic fractures. So under etiology, we have 2 subheadings. One is trauma and one is pathology. Now trauma is the etiology here. Because of trauma, this is the karana. The karya what we have is the fracture that occurs due to trauma is called as traumatic fractures. Now this is self-explanatory, as I said. It means what? The fracture has occurred because of an external trauma. Fracture occurring because of an external trauma is defined as traumatic fractures. Now in general, every bone will have its own capacity to withhold or to sustain force, certain amount of force. So every bone has its own capacity to sustain certain amount of external force. Now when because of trauma, this external force, when the external force is greater than the sustainable force of every particular bone, then what occurs is a fracture. So until that, it is able to sustain the force. When the force is beyond its sustaining capacity, then what occurs is a traumatic fracture due to trauma. So this is evident. Quoting an example for the same, very simple, fracture due to fall. So this is the basic example for a traumatic fracture. Due to fall, due to fall, there are various things to be kept in mind. The direction of fall, on which anatomical position or the posture, everything matters. That we will deal with individual fracture, especially with respect to the femur and the humerus. Now here, quoting a basic example, an example for the traumatic fracture is fracture due to fall. The next thing what we will be moving on to is the pathological fracture. Okay, now we have the second variety, that's the B. So we have pathological fracture. So what does that mean? Excuse me, fracture has occurred because of even a simple amount of force or a stress on the bone, and the bone has weakened because of an underlying pathology. So the underlying pathology affecting the bone is the prime etiology for pathological fractures. So this what it leads to? This leads to pathological fracture. To be kept in mind here is even with simple or trivial external force. So this is very important here. So as we said, in case of pathological fracture, the natural amount of sustaining capacity of every bone, even that is lost. So because of that, what happens? Even a very trivial external force will also render the bone end up with fracture. So this is called as pathological fracture. So under the etiology, now we are seeing the first classification, that is based on classification of fracture based on the etiology. Under that we have two, that is the trauma. The two etiologies are, one is trauma and one is pathology. Now external trauma leads to traumatic fractures. So when the external force or the traumatic force is greater than the threshold force of or the sustaining force of the bone, then that leads to traumatic fracture. An example is a simple fall, fracture due to simple fall. Next, now we saw the pathological fracture. Here what happens is, because of an underlying pathology that is affecting the bone, even a trivial external force or a minimum amount of external force itself will render the bone to end up with fracture. So this is called as pathological fracture. A simple example, fracture due to osteoporosis. So this is a simple example. So one thing what we have to look here is osteoporosis is almost the first causative factor for a pathological fracture. Usually this is the leading cause for pathological fracture. So now we move further. So first, now we saw the etiological classification. Now the second classification what we are going to see now is based on displacements. Now we have the second variety, that is displacement. Now again in displacement also we have two subclassifications, A and B. So first is simple undisplaced, or the fracture fragment is undisplaced. There is no displacement. Undisplaced fracture or fracture with displacement. So these are the two varieties. So the first one, undisplaced fracture, is very simple. It means that it's a It's a typical fracture pattern with no displacement of the bony fragments. With no displacement of bony fragments or the bone tissue. So this is called as an undisplacement fracture. So suppose for examples, this is the bone and here you have a fracture. The anatomy of the fracture is the same and it sustains a fracture within its bone tissue, but this bone tissue has not displaced. The fragment of the bone has not displaced. This is called as undisplacement fracture. One thing I forgot to say is again very common, is the definition of fracture. So what is fracture? Fracture is nothing but a discontinuity in the bone tissue. So this is, for example, this is the bone before any external trauma. So on this, now there is external trauma or external force that is acting on the bone tissue. So then what happens? Because of the force, there might be a discontinuation in the bone tissue. There is a discontinuation in the bone tissue. So this is nothing but fracture. So in undisplaced fracture, there is no displacement of the bony fragments or the bone tissue. Now we move on to the displacement, fracture with displacement. This is very important. So now we move on to fracture with displacement. So this is B. One thing what we have to keep in mind is, suppose this is the fracture fragment of a single bone. So whenever we speak about displacement, it is always spoken with respect to the distal fragment. So this rule has to be kept in mind, that whenever displacement of the fracture fragment is spoken, it is not with respect to the proximal fragment, it is always spoken with respect to the distal fragment of the fracture. So this simple rule has to be kept in mind when we are speaking about displacement. Now we will see. So what is fracture with displacement? As the heading says, wherein the fracture fragment has displaced, the distal fragment has displaced from the proximal fragment, is fracture with displacement. I repeat, what is fracture with displacement? Wherein the distal fragment of the fracture has displaced with respect to the proximal fragment. Now again, with respect to this fashion of displacement, this can be classified into three again. So the first is a simple, let's write in a different color. So the first is a simple shift. The next is angulation. The third is rotation. So when we are speaking with respect to displacement of fracture, it is with respect to the distal end of the fragment. So we see how the distal end of fragment has displaced with respect to the proximal end of the fragment. So while doing so, three fashions is possible. Three fashions of displacement is possible. That is, the first one is a simple shift. The second one is angulation. And the third one is rotation. Now suppose we put it in a pictorial representation, it will become even more easier to understand. So first is a simple shift. So in case of simple shift, what has happened? I'll write the proximal fragment in black and the distal fragment, the displaced fragment in red, so that it is easy to understand. So this is the proximal fragment and here you have the fracture. So in simple shift, what happens? So the distal fragment has shifted from the vertical axis of the bone. So this is shift. So it can be a left shift or a right shift. This is called as shift displacement of fracture, wherein the distal end of the fracture fragment has simple shift from the center axis of the bone, center axis of the bone tissue. So this is shift. The next variety is angulation. Angulation, I'll be writing it here. So angulation, this is the distal fragment again. Okay, and now I'm sorry, this is the proximal fragment again, and next is the distal fragment, maybe. So here you can appreciate an angle, right? So this is angular displacement of fracture, wherein there is an angulation between the proximal fragment and the distal fragment. So this is the distal variety. Now the third is rotational variety. So in rotational variety, what happens? I write it here. So this is the proximal fragment. I write that this is the distal fragment. But what has happened here is there is a twist or a rotational movement of the distal fragment. So this is indicated by the arrow mark. So here what happens, because of the external force has caused the distal fragment to rotate on its axis. So this is the rotational displacement. So just brushing up it again. So now we are seeing the displacement variety of the classification of fracture. In the displacement variety, we have two types. One is undisplaced and next is fracture with displacement. In undisplaced fracture, what happens? It is simple that one thing to be kept in mind, always displacement is spoken with respect to the distal fragment. In undisplaced fracture, the distal fragment and the proximal fragment have not displaced with each other. In fracture with displacement, we have three varieties again, that is displacement, shift displacement, an angular displacement with angulation, or an angular displacement. We have displacement with rotation. So in shift, what happens? The proximal end shifts either to the right or to the left with respect to the proximal end of the fracture and with respect to the vertical axis of the bone. In the angular form of displacement, what happens? There is an angulation that is formed between the proximal end and the distal end. So this is the displacement with angulation. The third variety is rotation, wherein the distal end of the fracture has rotated itself, or it has overturned itself with respect to the vertical axis of the bone. So this is with respect to displacement. I hope now the second variety of classification, that is with respect to displacement, is clear. Now we move on to the third variety of classification. Now we move on to the third variety of classification, that is basis of relationship with external environment. Relationship of fracture with external environment. Okay. So this is the third variety. So what happens here? So we have two varieties again under this. Okay, A and B. So in A, what we have? It is simple or closed fracture. It is simple or closed fracture. So here we have compound or open fracture. So these are the two varieties. Now what happens in a simple and closed fracture? So suppose this is the bone tissue. Okay. So this is the bone tissue. And now attached to the bones, what we have? Attached to the bones, here we will have muscles, ligaments and tendons. So these are the bony attachments, along with the neurovascular bundle, everything running inside them. So the next we have, covering them, we will have the skin. So this is the skin. So now we have skin. This is the attachments. That is, you have the muscles, tendons, ligaments, vascular bundle, etc. And this is the bone tissue. Now, here in this bone tissue, what happens? There is discontinuation here. We have a fracture segment here. But what happens in simple or closed fracture is that because of an external force. So this is the external force. Because of an external force, it's leading to fracture. But that fracture is such that it is simple or closed, which means that there is discontinuation of, or there is breaking of in only the bone tissue, and the surrounding muscles, whatever the muscles and tendons attaching to it and the skin are not discontinued, or there is no break in the skin or in the musculature that is attached to the bone. There is discontinuation only in the bone tissue. So this is a simple fracture or a closed fracture. Why it is called closed? Because the fracture is closed within and it is not communicating with the external environment. That is why it is called as simple or closed fracture, wherein the discontinuation is only in the bone tissue and not in the muscle layer or in the skin. So the skin and the musculature are intact in case of simple or closed fracture. Now, what is the case in case of compound fracture? So now we have we have the bone, surrounding the bone we have the muscles, tendons and the neurovascular bundle, and covering that what do we have? We have the skin. Okay, so now we have an external force acting on it. It's also called as fractural force. Okay, so external force, fracture force, not fraction, I'm sorry, fracture force. It is also called as fracture force. Now we have a fracture force acting on it. This leads to a discontinuation in the bone tissue. Not just that, it will also lead to the discontinuation in the muscle and the muscle attachment. It will also lead to the discontinuation in the skin also. So what we have now? We have a fracture here and there is breaking up here also. So what has happened now? The fracture is in contact, or the relationship of the fracture with external environment is happening here. So the fracture is in contact with the external environment. So such a fracture is called as compound fracture, wherein you have a discontinuity not just in the bone tissue, there is discontinuation although in the muscle layer and also with respect to the skin, such that the fracture is communicating with the external environment. So this is called as compound fracture or open fracture. Why open? The fracture, the relationship of fracture to the environment is open here. Here the fracture was enclosed within the skin and the muscle layer. So here the skin, the muscle and the fracture, all of them are open and it is in contact with the external environment. So this is called as compound or the open fracture. I hope it is clear. Now again, with respect to compound or open fracture, there are two varieties. So that will be, again with respect to compound or open fracture, there are two varieties. Now what is that? It is called as internal compounding and the next one is external compounding. So what happens with respect to internal and external? Now in the same figure I will make certain changes to explain the internal compounding. Now what is internal compounding is the relationship from within, that is compounding from within. It is also called as, there are two names for it. This is also called as compounding from within and this is called as compounding from without. So compounding from within, compounding from without. Now what happens in the case of compounding from within? So here we will see that this is the bone. Now as of now, everything is intact. Everything is intact. We have the skin also intact in situ. Now we have an external force. External force causes a discontinuation or it breaks the bone tissue. Okay, so now we have a breakage in the bone tissue. Now suppose during the process what happens? Maybe this portion, it has broken like this. The discontinuation is like this, such that some part of the bone tissue, it projects out from its surface or in plane. So in the meanwhile, what is it doing? Okay, we'll take it in here. So in the meanwhile, what is it doing? It is injuring the muscle layer. It is also injuring the skin. So here what happens? There is a discontinuation in the muscle layer and also the skin. But it is happening from within, that is inside. So that is why it is called as internal compounding. So the fracture is coming to, it is getting exposed to the external environment because of a portion of the fractured end that is piercing from within and disrupting the muscle layer and the skin layer. That is why the fracture becomes open with the external environment. Now what happens in case of external compounding or compounding from without? So here we have the bone tissue. We have the external force here or the fracture force, or I'll write it as FF in short, or the fracture force here. So what happens? So here we have the muscular layer and we have the skin intact here. So now we have a discontinuation. Okay. Suppose you have a log of wood, okay, that is being beaten or hit or anything, some metallic instrument that is being, thrown upon or that is being thrown. So what happens? Because of this external force, or it could even be a knife or anything, because of the external force, because of the external force, what is happening here? This is coming. So suppose it is being hit by a metallic rod or something else. So this rod comes and breaks the bone tissue. Further it goes down deeper and it also disrupts the muscle and the skin. So what happens here? From the external, you are making the fractured end come in relation to the environment. That is why it is called as compounding from without or external compounding. I repeat, here an external force or some object that is being acted upon from externally, which pierces during the action. What happens? For example, you are hitting a person with a knife or a big metallic rod. So what happens during the action? You cut the skin first. I'm sorry, this this is written this side, it will be of more sense. So this is a rod. So while you are hitting, what do you do? First you break the skin, then it breaks the muscle, and then it breaks the bone tissue within it. So this is called as external compounding. So this is the explanation for classification of fractures with respect to relationship with external environment. Now we are left with the last one. That is fractures based on the pattern. I hope fracture with respect to displacement was made clear. It is of two varieties, the simple, the undisplaced, and the displaced. Sorry, with respect to the external relationship with respect to external environment, first is the simple or the closed. The next one is the compound or the open. So in the simple variety, what happens? There is just the fracture within the bone tissue, but the muscles and the skin layer are intact. What happens with respect to the open or compound fracture? It is again of two types, from within or from without, which is called as internal compounding or external compounding. In internal compounding, because of the external force or the fracture force, the fracture fragments break first, and there is a portion of bone tissue that pierces the muscle and the skin and comes out, making the fracture exposed to the environment. So that is internal compounding. In external compounding, what happens? Because of some external object that is being hit, it first breaks open the skin, the muscle and then breaks the bone tissue, making the fracture again coming in contact with the external environment. One thing I must while saying is, very important thing is that the compound fractures are always more prone to infections. Compound fractures are always more prone to infections. This thing we have to always keep in mind while treating or taking up a case of compound fractures. So now again, now the last classification, that is based on the pattern of fracture. So the next classification is based on pattern of fracture. So in the pattern of fracture, we have different varieties. So the first is transverse, next is oblique, next is spiral, next is comminuted, the last one is segmental fracture. So under the classification of fracture, classification based on the pattern of fracture, we have 5 varieties. That is, the first one is transverse, second is oblique, third is spiral, fourth is comminuted, and fifth is segmental fracture. Now we will see what each of this means individually. So the first is transverse fracture. So the first is transverse fracture. So here how are we classifying this is with respect to the axis, the fracture line with respect to the vertical axis of the bone. So this is how all of these patterns are classified as. It is with respect to the fracture line. So how is the fracture line with respect to the vertical axis of the bone is how we classify fractures under pattern of fractures. Now the first variety is transverse fracture. So here it is very simple. I will depict all of them just with pictures with minimum words. So the first one I will be writing it here. So the first one is transverse fracture, wherein that is the fracture line is perpendicular to the vertical axis of the bone. So this is called as transverse fracture. Now what happens? Now what is? And the second one is here. So this is one. Second one is oblique fracture. So in oblique fracture, what do we have? So the fracture line is oblique with respect to the vertical. So this is oblique fracture. That is, the fracture line is oblique with respect to the vertical. So this is called as oblique fracture. Now the third one is spiral fracture. So what is spiral fracture? That is, the fracture line, it runs spiral. You know, again, this is like this and you have another one. So that is spiral, something like this. So with respect to the bone tissue, so this is called as spiral fracture. So it happens in 2 planes actually, 2 planes of the same bone. So this is called as spiral variety or the spiral fracture. Now the fourth one is comminuted fracture. This is the fourth one. So in comminuted variety, what happens? There will be many bony fragments. So suppose there is fracture here. Okay. So the fracture has occurred in this place, but the bone tissue in this place has broken into various fragments. So this is called as comminuted fracture. So this is called as comminuted fracture. So the fifth variety is segmented fracture. The fifth variety is segmented fracture. So what happens? Two types of fracture can occur in the same bone at different places. That is, it renders the bone to segments. That is why it is called as segmented fracture. So suppose here you have an oblique fracture. Down again, you can have a oblique fracture. Okay. So you have two segments of fractures, and that is why it is called as segmented fractures. So in case of segment fracture, at both the places you can have a transverse variety, or at one place you can have transverse, in the other place you can have either oblique or you can have comminuted. There can be a combination of fractures in segmented fractures. Now, there is a typical, kind of force that should act upon to render a bone to such a pattern of fracture. So suppose, now first one is the simple variety. For transverse fracture to occur, usually the external force is a tapping force or a bending kind of force. I write it in red. So you need a tapping force or bending force. So for the transverse variety of fracture to occur, the external force that is acting on the bone is usually a tapping force or a bending force. Next comes the oblique variety. So here it is again the bending force that is acting for a oblique variety. Now for the spiral variety, for something to happen like a spring or in a spiral fashion, you should have a twisting force. So here it is. So here it is twisting force. Now for comminuted fracture, what you need is, for comminuted fracture you need a compression force here. So for comminuted fracture, what we need is a comminuted force. So for the segmented, it is always a combination. So for the segment level, it is always a combination. So here we can see that for comminuted fracture, there are two varieties actually. It can be a compression or it can also be a simple crushing force. I repeat again. So this is the last variety of classification of fractures what we are seeing, and this is based on the pattern of, and this is called as pattern of fracture. Now on what is this classified? It is classified based on the fracture line with respect to the vertical axis of the bone. So in that case we have the first variety, that is the transverse fracture. So the first one is transverse variety. In transverse variety, what happens? The fracture line is perpendicular to the vertical axis of the bone. This is transverse variety. Next we move to the second variety. The second variety is oblique variety. So here what happens? The fracture line is oblique with respect to the vertical plane. So it is oblique. Fine. The third one is spiral variety. In spiral variety, we have the fracture line moving. It occurs at two different levels or segments of the bone. That is called as spiral fracture. Next one is comminuted fracture, wherein because of the external force, wherever the fracture is occurring, the bone is subjected to multiple fragments. That is very important. You get bony fragments in case of, many bony fragments in case of comminuted fractures. Next is segmented fracture, which is a combination of the above fractures. So it renders the bone to two segments, multiple segments, not just two or more segments. two or more segments. So this is called as segmented fracture. Now we have a typical kind of external force acting on each of for the pattern of each of these fractures. So what is that? For the transverse variety of fracture, usually the external force is a tapping force or a bending force. For the oblique variety, it is the bending force usually. So it is not that by a bending force only an oblique fracture to occur, but most of the time, usually these kind of force, they tend to exhibit the fractures are because of these kinds of force. These kinds of force, they tend to make the bone break in this particular pattern or fashion. That is why it is called so. So bending force, it leads to an oblique fracture. Next is the spiral fracture. We know something to occur like a spiral. So this when you have a twisting force, then what happens? You have fracture at two levels. So that is like a spiral variety. So that is why it is called as spiral fracture, that occurs because of a twisting force. Next we have the comminuted fracture. In comminuted fracture, because of an external force, the bone tissue is rendered to multiple bony fragments. That is why it is called as comminuted fracture, and the force acting here is either a crushing force or a compression force. So the bone, it is crushed or it is compressed. It is, something is crushed from the top. The bone is crushed, like for in case of, a road traffic accidents where a heavy vehicle moves, the tire moves on your leg. So the underlying bone is crushed between the road and the tire. So that is a crushing. The other one is compression, when there is compression of a bone from both the ends. So that leads to comminuted fracture. The last one is the segmented variety, where it is a combination of all of these, which renders the bone to two or more segments. So this is classification of fracture based on the pattern. So with this we completed the classification of fractures. Basically there were four varieties. So first one is based on the etiology. Under that we had two, that was traumatic and pathological fractures. Okay, so under classification we had four varieties. So first one was based on the etiology, traumatic and pathological. The next one what we saw was based on displacement. We had undisplaced and displaced fracture. The next one was based on the relationship with respect to external. So we had the simple or closed, and then we had the compound or the open kind of fracture. The last variety was based on the patterns, where we saw there are five varieties: the transverse, oblique, spiral, comminuted and the segmented fracture. Now we are left with another 10 minutes. So we'll go with certain fractures with respect to eponyms, and we'll end the class. Pathological fractures we will deal with the next class. So we have examples of fracture with eponyms. There are many and many based on this, but we will see a simple and basic famous examples under this heading. We will see 10 of them. Okay. So as I told you, it is based on the doctor, or it is based on the orthopedician who has identified it, or who it is named after the orthopedician usually. So that this is fracture with eponyms. So the first one, the basic one is Nightstick fracture. So what does it mean? So here again it is based on the the event that follows, the fashion or the pattern with which the fracture occurred, or also it is named after the orthopedician. So in this case it is on how it occurs. It is based on the fashion of fracture. So in nightstick fracture, usually it is a fracture of the fibula. So what happens? Now somebody wants to hit you. The first thing or the first action what our body shows is, we try to avoid the hit with the help of our hand. So we try to avoid it. So then what happens? The hit or the external force falls on this part. So this is called as nightstick fracture, wherein the shaft of the ulna is hit. Okay. So this is the medial end. This is the distal end. So medially we have the ulna and medial and the lateral. Laterally we have the radius. So when you prevent somebody is beating you with a stick, you want to prevent it. So what comes in contact is the shaft of the ulna, and that is called as nightstick fracture. Okay. The second one is Cole's fracture. Third one is Smith's fracture. Usually they go hand in hand. So what we learned in the last class, that the corticocancellous junction is usually more prone to fractures, is what we see here. Both of these fractures occur in the corticocancellous junction. Corticocancellous junction of what? Both of them again occurs in distal 1/3 of radius. Both of them occur in the distal 1/3 of the radius. What is the difference between Cole's and Smith's is that Cole's has with a dorsal tilt, and Smith fracture, it's a ventral tilt. When we go with respect to the fractures of the upper arm, we will deal this in detail. As of now, this is the analogy, ventral tilt. So, in both of these, Cole's and Smith's fracture, it's a corticocancellous fracture of the distal part of the radius, wherein with Cole's it is a dorsal tilt and with Smith's it's a ventral tilt. So, sometimes it becomes difficult, so you can just remember CD. So, because of that, you can remember this. So, Cole's is dorsal tilt. So, obviously when this is dorsal tilt, Smith's is ventral tilt. So, this is the part where usually it gets confused. Which one is dorsal and which one is ventral? Okay, we found this. The next famous fracture, what we usually see is there is something called as boxer's fracture. So where it happens? Boxer's fracture happens at the neck of the fifth metacarpal. So usually the boxers, this is the fashion. So when they hit, so this is the place which is more prone to. So that is called as boxer's fracture, wherein the neck of the fifth metacarpal is fractured. Next famous one is, we have something called as Pott's fracture. It is fracture of, it is usually a bimalleolar ankle fracture. Pott's fracture, bimalleolar ankle fracture. Boxer's is neck of fifth metacarpal. The neck of fifth metacarpal is boxer's fracture. Next, we have something called as March fracture. This is also a stress fracture. Now, why is it called March fracture? It is usually seen in soldiers. And where does it occur? It occurs in the shaft of second and third metatarsal. Why? So soldiers are usually, they march and they kick their foot very hard on the surface. So that is why, because of that, what happens? Because of continuous stress, their second and third metatarsal is prone to fracture because of continuous stress. So it is called as March fracture. It is because of the series or the fashion, because the soldiers, they march a lot, and because of that there is stress, and because of the stress there is fracture. That is why it is called as March fracture. It is also to be seen that it also occurs in doctors, especially surgeons who stand for a longer time. There is 6 and 8 hours of duty more than OT more than that. In such cases, what happens? Because of prolonged standing, because of the stress again on the foot, they can have more. They are more prone to have March fracture. Now, after March fracture, we have something called as whiplash fracture, which occurs in the cervical vertebra. This occurs in the cervical vertebra, and especially you can see this in small kids. Now, what happens? you tend to take the kit in your hand, and we do, to in a attempt to make the kid smile or to entertain the kid, we are usually prone to shake. So in such cases, what happens? The neck part, there is flexion and there is extension in the same amount. So when there is a more amount of flexion and more amount of extension in the same time, it leads to whiplash fracture. Now again, this not that it occurs only in small, in infants, it can also occur in adults. Suppose there is flexion and hyperextension at the same time because of an external force acting, you get a whiplash fracture. Next, this very important chance fracture. So usually chance fracture is also called as seat belt fracture. So what happens in case of chance or seat belt fracture is that the driver is sitting, the car is moving. So suppose because of an accident or because of some, the upcoming vehicle, because of inertia, what happens? The vehicle stops because of an accident or because of a vehicle coming ahead of you. But what happens? Because of the inertia, the driver is sitting in his own place and he tends to move. There is a seat belt here. So what happens? The seat belt, it moves horizontally. It cuts through the muscles and the vertebra of the person or the driver sitting. So this is called as chance fracture, which leads to an horizontal fracture force leading to the compound fracture. It's a compound fracture because it's an example for external compounding, where the seat belt breaks through the skin, the muscles, and moves even beyond the vertebrae in some cases. That is called as chance fracture. So there are many examples for such fractures with eponyms. So these are the very basic ones of what we saw today. So in today's session, what we saw was, we dealt with the introduction to orthopedic trauma. We saw the classification of fractures, wherein we saw the basic varieties of fractures. Under each of them, we saw sub-classifications. Like for example, based on etiology, we had the traumatic and pathology, when undisplaced and displaced under displacement, internal compounding and external compounding with respect to the relationship with environment. And then we saw the pattern, the 5 varieties of patterns. And next we moved on to the fractures with eponyms. So we saw basic fractures like the Nightstick Fracture, Cole's Smith's Fracture, Whiplash and Chance Fracture, March Fracture, Pot Fracture. So there are many such fractures, and we also saw the Boxer's Fracture. There is something also called as the burst fracture, which occurs in the vertebrae because of a compression force. So suppose you are up the ladder and you fall down with head down. So what happens? Your head hits the ground and there is a compression force, there is a force acting over the vertebra, and that causes the compression of your body against the ground. So in such cases, it causes burst fracture of the vertebra. So there are many fractures actually with respect, if you have to call it with eponyms. These were certain basics what we did today. So in the upcoming class, that is the next Monday between 3 to 4 p.m., we will be seeing what are pathological fractures, what are the varieties and how it happens, the basic treatment and diagnosis of pathological fracture, and upcoming in the next session, if we have time, we will take we will also deal with injuries to the joints, that is how dislocation occurs, and we will move further with the topic. So with this, I like to conclude today's session again with a prayer. Om Namami Dhanvantarim Adidevam Surasurai Vandita Pada Padmam Loke Jararubhayam Mrityunasham Dataramisham Vividaushadhina. Om Shanti Shanti Shanti.